Good morning again. I sort of feel like I'm saying thank you again because yesterday afternoon when we got started, I said thank you, and I said all the things that I wanted to say to welcome you, some of which I'm going to say again today. So I just wanted to thank you for coming here again for the second day. Yesterday, as I said, was really about practice, meeting people, learning new skills, learning new information, how people were dealing with traumatized children. I went downstairs in the other building yesterday and listened to, not that I understood, but listened to a couple of presentations in Spanish, which is really exciting because you should understand evidence-based treatments are not trained in Spanish. This is a really remarkable thing that some of our Spanish-speaking providers, of which about 40% of the mental health services provided to LA County Mental Health in Los Angeles County, are provided in Spanish to monolingual Spanish-speaking families. So that's really, really exciting that we're able to offer that to a lot of those families. I also mentioned that today really is about some of the presentations and listening to some speakers, and we have several speakers to talk with you this morning. But I also wanted to give a couple of other thank yous. First and foremost to First Five Los Angeles. We have been supported very well by First Five Los Angeles, both for putting on this conference as well as for our effort in training mental health providers. Also wanted to thank our partner, LA County Department of Mental Health, who I believe are sitting over here at this table, who have been instrumental in working with a lot of the provider agencies. Every time there's a glitch in the system, we then hit the auto dial and talk to our LA County mental health people, and they're very supportive in helping put this together. You will hear Sam Chan talk a little bit later on this afternoon, who'll talk about the Blue Ribbon Commission that's very in the news in Los Angeles right now. Also want to thank UCLA. We're in a different venue. I liked the room we were in yesterday, and I like this room a lot also. So I wanted to thank UCLA for helping us to put on this presentation, and also thank you for your attention, your willingness to come here, your willingness to learn about PCIT and helping families. It's part of the mission, as I've always talked to you. The mission really is to provide quality service to children and families at risk, and that's what PCIT does, and that's what you're doing. So I want to thank you very much for being here. Because we got a little bit started, I took a lot of photographs yesterday, and I self-selected out the bad ones, and they didn't quite work on the computer and running a little bit late. But I will run them later on this afternoon of many of the photographs that I took of you, and you can decide for yourself if you think I take good pictures or not. I thought there were a lot of good pictures. But I wanted to introduce and get started on our program this morning and introduce Kim Belshé. Kim Belshé is the Executive Director for First Five Los Angeles, which is a significant provider and supporter of 0 to 5 mental health services for Los Angeles County. And she's going to talk to you some this morning about what are some of the important issues starting strong and starting healthy children in the 0 to 5 age, which is the mission for First Five Los Angeles. Kim Belshé is a native of San Francisco, which I did not know, with a master's degree in public policy from Princeton University, and has held a number of positions in California throughout the last few years, just a couple of years. Aside from, or prior to, prior to being executive director at First Five LA, she was also part of the senior policy advisor for Public Policy Institute of California. Somebody will help me in just a second. She also held previous leadership positions under former Governor Pete Wilson and Deputy Secretary of the then Health and Welfare Agency for Pete Wilson, and as well as holding leadership positions in a number of philanthropy organizations. Prior to First Five LA, she was also with the James Irvine Foundation. So I'd like to introduce Ms. Belshé, who will talk with you about, I almost gave you a whole new degree, Starting Smart, which is some other part of the mission and the effort of First Five Los Angeles. Thank you.
Thank you, Anthony. Good morning, everyone. So let's see, I almost became a doctor. I think I became about 24 years old. I have had a long history in public service and actually most recently served in Governor Schwarzenegger's administration as Secretary of Health and Human Services. And a lot of folks say, well, you know, you've had these big state jobs, you know, what are you doing in LA? And I'm like, my God, LA is a nation state. And I actually believe very firmly in what I call the anti-Las Vegas principle. I call it the LA principle. So Las Vegas, you know, what happens in Vegas stays in Vegas. I believe in the Los Angeles principle, which is when something happens in LA, people pay attention. If you can affect change in a county of the scale, the size, the diversity, the complexity, the dynamism of LA, people pay attention. So that's why I came to First Five LA just short of 2 years ago. First Five LA is, hopefully all of you know, is a child advocacy and public grant making organization that's focused on the health, the safety, the school readiness of young children. We've been around, like the other First Five commissions throughout California's 58 counties, for just over 15 years. And so in my capacity as executive director, I'm delighted that First Five LA is a sponsor of this 14th annual PCIT conference. And I, like Anthony, want to extend my thanks and appreciation to UC Davis for organizing and hosting today's and yesterday's conference, as well as our colleagues and partners at the Department of Mental Health, whose director, Dr. Marv Southard, serves on our board of commissioners, and who has been a terrific partner of First Five LA in so many ways. This morning, I want to talk a little bit about some of the things that are going on at First Five Los Angeles that I think have some relevance to your work in the world of PCIT and more fundamentally in our work together to prevent violence and child abuse and neglect. It's an interesting time at First Five LA, as I'll talk about in a moment. We are an organization in transition. But one of the enduring concerns of our Board of Commissioners throughout the past 16 years that continues in the context of our current strategic plan is that we need to play a role in partnering with others to ensure that children are safe from abuse and neglect. The data, the statistics that undergird our commissioners' concerns and interests in child abuse and neglect are statistics and data that imbue and inform the work you all do in community on a day-to-day basis. We are very mindful as a funder that we are not the doers. We support others such as you who do the hard and important work to strengthen families and improve outcomes for young children in LA. And really, I understand we have people here from Norway, from Iowa, from Tennessee, Texas. I'm probably not going to get all the states, but I really want to acknowledge this is not just an LA imperative, but really a national imperative around child safety. The statistics that really compel our commissioners, though, we understand at both a broad level, a macro level, but also at a very direct and personal level, because behind each and every big number are the lives of specific children and their families. That data, those stories, they tug at our hearts. We are a part of government. Government has a heart, and it does tug at the hearts of our commissioners. It does lend urgency to our work, and it does compel action. So I want to talk with you this morning briefly about two areas of activity that reflect the First Five LA Board of Commissioners' recognition that strengthening and supporting parents in terms of their ability and capacity to really support and nurture positive relationships with their children, how that really imbues a number of our important investments that we have been undertaking in recent years. So first is I want to talk a little bit about place-based work. Our Board of Commissioners, in the context of our current strategic plan, and we're in the final year of a 6-year strategic plan, said, you know, we want to test some innovative strategies for improving child safety and child well-being. And yes, direct services are important, but direct services also have some limitations. And we want to partner with communities in new and different ways to strengthen community capacity to improve outcomes for children. So our commission embarked a number of years ago on a place-based initiative that we refer to as Best Start, where we're working very purposefully in partnership with community in 14 what we call Best Start communities. And there's two strands of activities that we are advancing that are complementary in nature, but both of them are grounded in our commitment to supporting parent and family strengthening. The first is a direct service strand of activity that we refer to as Welcome Baby Home Visitation, and it's supporting promising as well as evidence-based models of home visitation. It reflects our recognition that young kids, newborns, they don't come with an owner's manual, as it said, and all parents, not just certain types of parents, but all parents need some help. And so this is a universal home visitation program in these 14, for parents that live in these 14 communities. That provide light touch up to 9 telephonic and in-person contacts to support parents in terms of their skill building, their knowledge around child development, their ability to connect to concrete services and supports, and to support stable, safe, and responsive home environments for their children. At the same time, we know that some families need more help. And so informed by the hospital-based assessment, we are investing in evidence-based home visitation programs that will endure for a number of years if need be to support those families that are struggling with the most significant issues around domestic violence, substance abuse, behavioral health, and so on. This is a significant investment we're making. But importantly, it is not an investment in direct services, important as they may be alone. We are also investing in research and evaluation so that we understand what works in terms of this new kind of lighter touch approach, a universal approach for home visitation. We are also working in a very strategic and comprehensive way around policy and advocacy. Because at the end of the day, funders, whether it's a private funder like the California Endowment or a public funder like First 5 LA, we are not agents of scale and sustainability. Our resources are limited. And so we view our role as focusing, where we focus on services, doing so in a way that builds the knowledge base and then advocates with those agents of sustainability and scale, such as county government, state, and federal government, where programs are working to really extend the reach of those investments more broadly. The second strand of our place-based work is where we really are working in different ways with communities. We're focusing on community capacity building. We are engaging these 14 communities. We're working with community partnerships that have a very significant role for parents and residents, as well as service providers, business owners, educators, health providers, and others, to work together to advance some very specific results around family strengthening and community support. What we call the what we call the Building Stronger Families framework reflects our recognition and our partner community's recognition that if parents are strong and if community environments support parents, then child outcomes are going to improve. And specifically, the results we are seeking in our Best Start communities are those family strengthening protective factors that we know from the evidence correlate with the best possible outcomes for kids. So we're very supportive of efforts that advance parental resiliency, parent knowledge of early child development, support parenting skills, support parents' access to concrete supports in times of need, promotes informal networks and supports, which we know are so critical, and which advance children's social and emotional competence. So this place-based work is hard. It's different, it's complex. In some respects, it's much easier to fund a direct service and to measure the number of children served and outcomes. Supporting community capacity building, investing in social capital is much more difficult. And I commend our commissioners for being willing to take a risk and working with communities in new and innovative ways to improve outcomes. It is hard, it is complex, as I said, but it's also a very promising strategy that offers the potential for sustainable change over time. A second current investment that I want to call out is really what brings you all here for this conference, and that is PCIT. First 5 LA is really pleased to be partnering with the Department of Mental Health and partnering with UC Davis to support a significant investment expansion of PCIT in LA County. We are investing $20 million over 5 years in PCIT. It reflects our commitment to supporting the Department of Mental Health and building the capacity of LA County's mental health providers to work with their patients, to work with their clients with young children with behavioral needs, and really build their capacity to offer PCIT. And in so doing, really strengthen families in terms of the child-parent relationship. I understand that this investment reflects the biggest expansion of PCIT in many, many years. And that's terrific because LA County, we are big and we have a lot of needs, and we are eager to invest our resources in a way that advance our fundamental interests in family strengthening. I understand from Anthony that some of the reaction to the PCI training has been that this is hard, that the training is hard, and the application of the training in practice is hard. Um, that's actually a good thing, because if this were easy, we would all be doing it. So I really want to commend you, those of you who are on the front lines, who are investing the time and effort to learn new skills and to apply new skills in a way that really supports parents and strengthens their relationship with their children. We view PCIT as a very exciting initiative, and it's one that demonstrates the power of prevention, the power of early intervention for our youngest children, particularly those families that are most at risk of entering the child welfare system. We are, as I said at the outset, an organization that is in transition. I came to First 5 LA about 1.5 years, almost 2 years ago, and undertook an exploration of kind of where we are with implementation of our current strategic plan, what are we doing well, where can we improve, but all of which has been grounded in our work with staff and commissioners in terms of how do we maximize our impact as it relates to promoting better outcomes for young children in LA County. Looking to the future, we are going through quite a few changes, and I want to touch on some of the things we're focusing on and things to look for as it relates to First 5 LA over the course of the next 5 years as we enter into now what is our last year of our current strategic plan. A couple of things that our board has done, and for those of you outside of LA who may be in other California counties, there's similar conversations unfolding. Because Proposition 10 that was enacted by the voters back in 1998 increased the tobacco tax by 50 cents. So that is the dedicated funding source that supports the work of First 5 here in LA and statewide. The good news is people are smoking less. That is terrific. But that means there are fewer revenues supporting Prop 10. And the Prop 10s are not going to be embarking upon social marketing campaigns encouraging smoking. That would not be an appropriate thing to do. You know, we'd have to say, you know, a pack a day, that's all we ask, just don't smoke it. It's not going to happen. It's just not going to happen. We are thinking creatively about other revenue options, but you know, fundamentally, we have a responsibility to live within our means. And First 5 LA, we are so fortunate to have this dedicated, albeit declining, revenue source. We expect to take in this year about $90 million. That makes us the largest funder of early childhood development programs and activities in the nation. The money going out the door this year, $240 million. So 90 million coming in, 240 million going out. Obviously, that is not a sustainable funding strategy. We're a very healthy organization. We have a large fund balance that we are expending down in terms of commitments we have made, such as our 5-year commitment to PCIT. So we will honor our obligations and with great vigor and enthusiasm. But as we look to the future, our commissioners are very clear. We need to live within our means. So the board has adopted a long-term financial projection that really provides that clarity about our funding projections and the need to make some tough choices, and that's what we're on a path to do. So that really the long-term financial projections, number one, presents that fiscal picture, the fiscal guardrails for our work going forward. The second thing our board did this year was they approved a new series of governance guidelines. And these are intended as new decision-making rules to advance our interests in transparency, accountability, and discipline. So for those of you who have perhaps been supported by First 5 LA or interested, these guidelines are going to be very important to our work going forward. There's a new emphasis in explicit rules around sustainability, for example, so that we're asking those questions at the front end of investments about the sustainability plan, as opposed to asking those questions 5 years into an initiative. There are new requirements around leveraging ensuring that First 5 LA dollars are not the only dollars being used to support important work. There's new requirements around expiring grants, which may seem axiomatic, but we actually have a guideline that says when contracts come to the end of their term, they come to an end. And that has been a very hard change because for First 5 LA, we have continued to support year after year many projects. And finally, a requirement that any new investment has to be clearly grounded in our strategic plan. Again, one would think that goes without saying, but it's actually a very important statement in terms of the roadmap going forward. And that leads me to the third strand of activity I want to touch on, and that is our strategic plan. So we have guardrails around our financial circumstances. We have new clear decision-making criteria. But this question of, so how do we contribute to a meaningful and measurable change in terms of outcomes for children? Our commissioners are very clear, excuse me, that our fiscal realities do compel us to think differently about our investment strategy in light of the declining tobacco tax revenues. But more broadly, our strategic sensibilities compel our commission to really think clearly about how we can contribute most effectively to impact. And so while our strategic planning effort is a work in progress, we are pivoting in a very important way. We are pivoting from spreading our investments over many, indeed dozens of small and sometimes large investments towards an approach that will favor systems and policy change over direct services, that will emphasize promising practices and evidence-based practices, that will favor prevention and upstream strategies, that will incorporate family strengthening and trauma-informed care components as possible and appropriate, and that will engage partners in sustainability at the front end of our work, not at the back end. At the center of the emerging strategic directions that our board is endorsing are parents. Parents in the context of family, in the context of communities, and in the context of these larger systems with which they and their children interact. This type of systems-oriented work and policy-oriented work is hard, it is challenging, and it will be different for First 5 LA. But it does reflect our commissioner's strategic imperative that we maximize the return on our investments in terms of improving outcomes for children. A couple things I would touch on in terms of what to be looking for, some of the issues we're wrestling with right now is, number one, we absolutely, I think our board has been very clear about continuing its focus on strengthening the evidence-based protective factors, as well as supporting local change efforts to promote family-supporting community environments. Again, we put parents at the center of our work because for children to start smart, for children to have a healthy beginning, it really is all about parents. At the same time, we are working to identify new opportunities to support the capacity of systems, specifically health, behavioral health, and substance abuse systems, to meet the needs of young children and their families. And in particular, we are looking at identifying opportunities to partner with others in a couple of areas, such as supporting and improving provider capacity to deliver trauma-informed care, a growing interest and concern of our commissioners, to improve the coordination of screening and early intervention programs to ensure that children are being timely screened, assessed, and referred so that we can address those concerns at the earliest address issues and concerns at the earliest moment possible in a child's development and growth. And finally, working with others to incorporate evidence-based parent engagement strategies in the context of systems, health-related systems. System improvement is going to be such a big, important area for us. It's hard. It's going to compel us to think about our work differently, to partner with others differently. But again, it's grounded in our commitment to maximizing impact, not in the context of discrete services, but really in terms of population-level change broadly. So I'd note in closing, we are an organization that has some hard choices to make. And those are choices that our commissioners, our Board of Commissioners, ultimately will be making. I know my colleagues have heard me quote Michael Porter from the Harvard Business School many, many times, but he has got a great quote when he says, the essence of strategy is choosing what not to do. And for funders, that's a big, big strategic decision looming very, very large. I do again want to express my appreciation to UC Davis for their terrific work that they've been undertaking with PCIT, to acknowledge my colleague Bill Gould from First 5 LA, who's been an important supporter and partner in the work of PCIT, and of course our Department of Mental Health colleagues who are working in a very direct way in building provider capacity around PCIT. What you are going to be hearing today, what you're going to be learning today, hopefully will be learning that you can put into action in your communities, working with parents and their children who have the greatest needs. We at First 5 LA are very much committed to working with you and so many others in terms of improving the conditions that shape the lives of young children at the earliest moments possible. So I want to close with a quote that my colleagues from First 5 LA have heard me use time and again, but I think it captures so well what we do at First 5 LA and what you all do. And it's Frederick Douglass who said in the late 1890s, "It is far easier to build strong children than to repair broken men." That is why you all do what you do, to build strong children. And that's why we are really honored to support you in that important work to build strong children in LA County and broadly. Thank you very much and have a terrific day.